Good afternoon. I would like to welcome you to today's program of the Art Alliance of Contemporary Glass's Friday programming series, MeetUp. I'm Jim Gerhardt. I'm the president-elect of AACG, and I'm your host today. I'm especially delighted to extend greetings not only to our members, but also to those special guests, as this particular program has been opened up to the public, including members of the ISGB, the International Society of Glass Bead Makers. The Art Alliance of Contemporary Glass is an international nonprofit whose mission is to further the development and appreciation of art made from glass. Our members include collectors, curators, artists, glass studios, educators, museums, galleries, auction houses, and other glass enthusiasts. If you are curious and would like to join us in our work, please visit our website, www.contemptglass.org, to explore our membership. I just wanted to make a brief mention that next Friday's meetup is representative of the grant program, the kinds of grants that we sponsor. And in this case, it will feature the Philadelphia sculptor and printmaker and glass artist, Jen Blazina. She has a special exhibition of her work currently on display at the Bergstrom Mahler Museum of Glass through October 5th. This exhibition is one of the many to which we make grants this year. Now, on to today's extra special program. Our guest is Dr. Jean Gribbon. She is the Chief Mission Officer and founder of Beads of Courage, Inc., a nonprofit organization that she founded in March 2005. In 2023, Jean was also appointed president of the Center for Arts and Nursing, a partner organization of Beads of Courage. Its mission is to support and strengthen experiences in human caring across the lifespan through arts in medicine programs. Jean has earned both her bachelor's of nursing as well as her PhD in nursing from the University of Arizona College of Nursing. The Beads of Courage program sprang from her doctoral dissertation and has now grown to be a standard of care in more than 400 hospitals in 9 countries. Using colorful beads as meaningful symbols of their treatment journey, Beads of Courage is a form of narrative medicine to help children coping with cancer and other serious illnesses record, tell, and own their story of courage. Please do not hesitate to put your questions into the chat option at the bottom of your respective screens, and following Jean's presentation, we'll open up the program to allow you to ask your questions. However, please remember to mute yourself during the course of the program itself. Jean, once again, welcome. Without further ado, the floor is yours.
Great. Thank you so much, Jim, for that wonderful introduction. Thank you, Linda, for behind the scenes pulling this meeting together. It's really an honor to have this opportunity to present our mission today. So I have a slide deck that I wanted to share to guide today's talk. Happy Friday, everybody. Great. Really, probably one of the things I'm most passionate about is sharing our mission amongst the artist community. As Jim shared, our mission statement is to provide arts and medicine programs for children coping with serious illness. And artists, you know and live this every day. And it's really an incredible honor for us to pass along the art of the bead to help children cope. I framed my talk. I recently, 2 years ago, finished my postdoc scholarship with Dr. Jean Watson, who's established the Watson Caring Science Institute in Boulder, Colorado. And she always shares in her work in educating nurses to help transform the caring of people around the world with her theories and work. We're busy humans doing that we forget we're a human being, that we're a human becoming, and what is always emerging for us. And so I framed this talk with that in mind. And I love to share with you as artists as well, this great opportunity at Beads of Courage. We say, like beads on a strand, we're all connected. And this opportunity to share our mission with the AACG artists, as well as other artists that are already involved in serving our mission. I like to think of how we're all connected. And there's a great book that I read during my postdoc, and it's titled Where Geometry of Art Meets the Geometry of Life. And I share with our team, and I'm sure you all had similar experiences where I call them little shoulder taps or angel speak moments, where you have these aha moments in the midst of your work that you're on the right path. And I hope today you'll be inspired by our mission, and maybe you've already been involved in some way, but most importantly, how your art could help the children that we serve at Beads of Courage. So as Jim shared in the introduction, as the founder, this has been a 20-year kind of path, if you will, creative scholarship process. The first Beads of Courage program was actually piloted in 2002, or I'm sorry, 2003 at Phoenix Children's Hospital. So in 2023, we celebrated our 20th anniversary as an organization. And as you all know, I'm excited to share with you today what's emerging for us. And most importantly, if you're not familiar with what we do at Beads of Courage, become a spokesperson in your community for the work that we do. Always lead with gratitude. Again, thank you so much for spending some of your lifetime today with me to learn about our mission. We're very grateful for the partnerships and caring that we have with artists. Our organization has worked very closely pretty much since inception with the International Society of Glass Bead Makers. We're also endorsed by the American Association of Woodturners. So woodturners have been donating beautiful handcrafted bowls that children can keep their bead collection in. And as you'll see, I hope that you'll be part of our string of strength and with our work here, and have added AACG to our artist community. So playing upon the geometry and thinking through the history of our organization, I'd like to share the background, points of intersection, if you will. I always like to say, let curiosity get the best of you, which is what happened to me when I began my practice as a pediatric oncology nurse. I quickly learned that while I was competent in caring for the physical needs of the patients I was caring for, what was missing were the tools in the toolbox for me to meet the emotional needs of my patients. And so that quest began when I entered my PhD program. I immediately started researching what coping interventions are out there to support children coping with cancer. And there was actually very little back then. And I like to think of Beads of Courage as beyond the sticker. Any pediatric oncology nurse or any pediatric nurse will tell you that you have a compelling need to give your patients something, and not as a reward, but something that they could hold on to as you bear witness to the courage each and every day, helping them cope with their treatments. I had the great opportunity to work at one of Paul Newman's camps, and it was while I was at that camp, I worked there for 4 consecutive summers, that some of the kids would come back each summer and they would be wearing something that they had made in their arts and crafts rotation at camp, whether that was a beaded bracelet or a necklace. And I thought, wow, you still have that bracelet or that necklace you made at camp last year? I don't know about you, but I lose things all the time. And I was just amazed that they had those beads. So curiosity got the best of me. I started Googling beads in humans. What are beads? Why do humans care about them? And in that discovery phase, discovered the Bead Museum, which at the time was located in Glendale, Arizona. The museum has since closed, but the entire bead collection was absorbed by the Menenge Museum, which is located in San Diego, California. At that same time, I had the opportunity to study under Dr. Joan Hawsey, who had just completed a really amazing study where she interviewed children who were completing their treatment for cancer. And at first I thought, wow, they're just going to tell you they're so happy they're done, Dr. Hawsey. And in fact, the results of her study were quite profound for all of us in pediatric oncology, in that she summarized in her findings 3 key things. 1, the kids were depressed, worrying about their treatment, worrying about recurrence. And so how can we alleviate those anxieties around recurrence? They were worried that they wouldn't get to see their nurses as much because, follow-up clinic, and they're used to seeing them each and every day. And then the third thing that's really compelling to our work at Beads of Courage is some of the kids that she had interviewed had said, you know, I've been through everything and I have nothing to show for it. Yes, of course, I have the physical manifestations, I went through something, but I actually have nothing tangible to show and tell others I went through this. And in fact, one child that she had interviewed said, you know, I've gone to war and back, and if I had gone to war, I would have gotten a Purple Heart. So the Purple Heart is actually our completion of treatment bead in our pediatric oncology program. So for me, that was compelling in that, wow, just as my experience in caring for them, they too are looking for something tangible. So when I visited the Bead Museum, which I'm sure this isn't new knowledge to you, but for me, it was great. And I will share with you, in establishing Beads of Courage programs in all the children's hospitals that implement it, we do train them in the background on our work. And most importantly, they're going to start giving beads to patients as an intervention that they too should know and appreciate that beads are part of our human history. In fact, I was amazed to learn that beads were our earliest art form. Quite literally, before we were painting on cave walls, we were finding ways to adorn ourselves with these small perforated objects. Beads have always been used as symbols of honor and accomplishment. If you do for fun, like I do, read up on any archaeological digs, they'll always say that person was buried with all these beads, of course, because that's how they would bestow honor upon them. So what we do at Beads of Courage is really no different than what humans have been doing for thousands of years. We give beads as symbols of honor and accomplishment while they're going through their treatment journey based on a bead guide. Some of the background as well, as I shared, we do educate all the hospitals in our work. These are some of the other theoretical perspectives that inform our work as a human caring intervention. And our pilot program, again, at Phoenix Children's was part of my original PhD research, and we continue to research the outcomes of the program. But that first program, we created a bead guide. I'm going to disappear here, but you can see it's a bead guide, and on that bead guide identifies all the different beads that nurses can then give at the bedside. So our organization equips every hospital with the beads they need. So those beads sit right there in the clinical setting. So as that nurse is hanging chemo, they're giving a white bead. As they're giving blood, they're giving a red bead. There's 18 different beads that we give. I'll be sharing with you some photos so you can see kind of how that visual illness narrative unfolds over time. Moving along kind of in the presentation, if you will, human doing to now kind of human being. As I shared, the first program was piloted in 2003. It was really around 2010 that you can see how old my kids were at that point. All these things were conspiring to really launch our organization and the work that we were trying to do. So it was in 2005 that we established a 501c3. So before that time, I was actually purchasing beads on a credit card because I believe so much in the work that we were doing and the benefits of kids. So before we were even established as a nonprofit, we had been supporting kids with Beads of Courage at 10 children's hospitals in the United States at that point. But it was in 2010. I didn't include the video. Jim and Linda, like if you have videos, but if you're intrigued by our work, all you have to do is Google CBS Sunday Morning Beads of Courage. That was aired in 2010, and that really helped launch our organization and our great work. Simultaneously, a Beads of Courage member in Atlanta, her dad was an engineer for NASA, and he knew that NASA at the time during the shuttle program would fly commemorative objects on the shuttle as part of the shuttle program. And he said, Jean, do you think we could send some beads if it gets approved? I'm like, yeah, let's try it. And of course it was approved. At that point, maybe some of you know these artists, but we launched a fun artist campaign that if you would like your bead to go on the Atlantis shuttle, it has to be space themed and kid friendly. And those beads actually went on the Atlantis shuttle. And that was a really amazing national effort. And really, I loved honoring those artists that had a bead that went on the Atlantis space shuttle. Of course, we're a nonprofit. I love to just share the definition of philanthropy. And I know that you all do in the creation of the great work that you do as artists, but art and the work that we do at Beads of Courage is really to strengthen humanity. And I'm excited to just share our mission again and hope that you'll be inspired to get involved with our mission and how you can contribute to helping kids with serious illness. This is our robust mission statement. Mostly we're known for the work that we do in directly supporting children coping with serious illness, but we do have additional programs that support families and the clinicians, which is actually a great place of passion for me as a nurse, is really supporting those frontline nurses. And so we have different programs, if you will, that target every tenet of our mission statement. Most importantly, of course, bead is our art form. I'm really proud of the work over the last 20 years, now 22 years, that we have educated over 6,000 healthcare providers in really glass art. I'm sure you can appreciate when you put a handmade glass bead in front of someone, most people are thinking, when they think of a bead, they're thinking Mardi Gras or costume jewelry or things that you wear, and just making them aware, no, this is an ancient art form, and there are bead people everywhere working at their torches, making and donating these beads so that we can give one-of-a-kind art beads to kids. I think no presentation's complete if you potentially don't leave with some new knowledge. And I like to share some knowledge that I educate people on the impact of our work from anthropology. So on one of my flights, I was seated next to an anthropologist, and he started telling me about his work, and I was telling him all about my work with Beads of Courage. And he's like, Jean, of course, what you do at Beads of Courage strengthens resilience, supports coping, all the things you're saying, that's true, but you're missing a big piece of the impact of your work at Beads of Courage if you don't get into the anthropology literature. And so, of course, we're all lifelong learners. He gave me some Sentinel work to read, ordered some of the books he recommended from Amazon. And I want to share this with you because for me, it's very fascinating, impactful in looking at our work at Beads of Courage through the anthropological lens of evidence. Number one is humans need objects. Other animals do not need objects to the extent that humans need objects. So knowing, as Jim said, there's some collectors that are part of AACG. You as artists are making things that people buy from you or want in their home. Anthropologists have been studying this for hundreds of years. Why do humans collect objects? The object is just an object. It's actually the human that ascribes meaning to that object. So it takes on more meaning and significance to that person. And at Beads of Courage, we give beads as meaningful symbols of their courage to honor their courageous journey. And anthropologists say, you know, the strength of an object lies in its ability to make visible that which is invisible. That's really profound for us at Beads of Courage because we are turning an experience that honestly would remain invisible, very visible for all to behold. You can see this great photo of Lilybell. I met her in Alabama. You can see her amazing bead collection. What you can't tell from looking at this photo is that Lilybell can't see. So of course we all innately look at Beads of Courage as this visual art form, a visual illness narrative, but for Lilybell, it really was holding her beads. She could go down her bead collection and tell me what certain beads were and when she got them. Again, making something very visible for her friends and family to honor her incredible, courageous journey. The second thing from an anthropological lens is that humans need to give gifts. Other animals do not receive gifts. Humans give and receive gifts. So again, anthropologists have been studying this. Why do we do this? Why do we give and receive gifts? And when you think about when you give gifts, you don't just give gifts to anyone. You most typically give gifts to people you love. You have reverence for their life. Gifts are often given during times of ceremony and ritual, birthdays, weddings, and or maybe someone has died. And what we do at Beads of Courage is equip nurses, child life specialists, other healthcare providers with the power to give a gift of a bead in a moment where that child is experiencing something challenging, something painful, something they don't want to do, and honoring them in that moment and having reverence for their life. And the last thing that is really powerful about our work is this term that anthropologists use, fancy term, human solidarity, which when you translate that and what the essence of human solidarity is that reminder that you're not alone in your fight for life. And so we have built a global bead community where there are children actively receiving Beads of Courage in 400 children's hospitals in 9 countries. And we refer to it as our global bead family because the beads that are used in every single Beads of Courage program are the same. The kids and families become very fluent in the language of Beads of Courage, and they know that there's other bead dads and bead moms out there that are supporting their child. Of through Beads of Courage. As a social scientist, nursing scientist, I typically use qualitative research to evaluate the impact of our work. And I love to share this photo of this young lady I met at Children's Hospital, Wisconsin. And one of my main interview questions is, just tell me what your beads mean to you. And this was very impactful for me metaphorically, because she's like, you know, Jean, I knew I was going somewhere with this when my bead collection exceeded the width of my wingspan. And I thought, wow, what a beautiful way. And you can just see again that spirit lift in her with every bead that she's collected in her cancer journey. This is an amazing photo I like to share. This is Chloe, who was one of the first Beads of Courage members at the University of Minnesota Children's Hospital. She got married now about 10 years ago, and her mom sent me this photo at that point, and she's like, wow, Jean, I knew you'd want to see this photo. None of us knew that Chloe would bring her beads on her wedding day to be photographed with them. And I thought that is so incredibly powerful. Again, the long-term impact of this work, that I've met so many Beads of Courage members that have, you know, young adults now that have their beads and they have them with them all the time. And so the impact of our arts and medicine mission, really, it expands the lifetime. So again, kind of framing the talk, humans busy doing, being, becoming, and emerging. I love art myself. My daughter said, Mom, you can be an artist. You can start drawing at least. And so she bought me my first collection of colored pencils. You can see some of my art here featured here, but you know, we really are all scholars of humanity. Those that collect our art, whether we're makers, collectors, bead stringers, it really is part of our thread of humanity. So in the becoming stage, what I've really been enjoying, I would say, in the past few years is really experiencing the long-term impact of our work. And what I love sunflowers, and just wow, the direction of light that is being cast upon our mission. And you all are part of that now. You're part of the sunflowers that can cast light upon the work that we're doing. So this is an example of experiencing the long-term impact of the work. This is Danielle when I met her when she was newly diagnosed with and going through treatment for cancer with her mom, Amy. Met them in Atlanta. We're actually at a studio there in Atlanta. A lot of studios host bead making days, beadathons, if you will, to make, they'll invite artists into their studio. And I met her there. And this is a photo of Danielle and I when she turned 16. And when she turned 16, her mom said, where would you like to go for your 16th birthday? And her response was, I want to go to Beads of Courage in Tucson, Arizona. I want to go to where they're based and see Jean. And I thought it's just pretty powerful story. Again, long-term impact. Another long-term impact, Charlie was one of our first Beads of Courage members at Phoenix Children's Hospital. In the middle there, that's Charlie graduating from high school. And then more recently, the photo of me is with another nurse, a pediatric intensive care unit nurse. Met him in Flagstaff when we started the program in Flagstaff, Arizona. And he's now a nurse. And he was one of the first Beads of Courage members too. And when he attended the training, he actually brought his beads with him. As you can see, he's wearing them in that photo. This is the young lady whose dad worked for NASA, and she too visited our headquarters in Tucson, Arizona. And that original photo when she was active in treatment, we were at the Atlanta Space Shuttle launch together, which was pretty powerful, thinking through the impact of our work. I am so proud and grateful for our global glass art community. The beads that we get donated, the pendants that we get donated, they really are the essence of our arts and medicine mission. Every bead that's donated, we have individually packaged by volunteers at our Forever Home in Tucson, Arizona, and then they are distributed to member hospitals throughout the world that implement Beads of Courage. So today, we have over 400 children's hospitals. We estimate there's roughly 50,000 kids every single day receiving beads based on the bed size of the hospitals that are implementing it. And annually, we distribute over 14 million beads a year. I like to share these stats because for me, it's just evidence of the need to bring more art-based interventions into the healthcare setting that can really strengthen that human spirit. And that's what we do. So here we are globally. These are the countries that we're in. It's great. Thank you again for the opportunity to present this week, because Monday was our 7th annual World Beads of Courage Day. So annually, every September 15th, we've established it as World Beads of Courage Day. And that's where we really just celebrate the courage of all the kids that benefit from our programming, the artists that give of their time and talent to sustain our mission, our donors, our member hospital partners globally. I wanted to share this map of impact, knowing that not knowing where everyone is zooming in from today, but it used to be the metric of curiosity. Hey, how many hospitals are you in now? But now really it's more about the number of programs we're providing. So what you might not know is that while we started supporting children coping with cancer with Beads of Courage, we've expanded our programming. We have different bead guides to support children coping with chronic conditions. Maybe it's a child with cystic fibrosis, a child that might need a liver transplant. So we have a chronic bead guide. We have a cardiac bead guide, babies, children coping with a congenital heart defect. And so you can see the number of programs in the 3 regions in the United States alone. So we have a big scope of outreach and helping kids and working collaboratively with all of these children's hospitals in all of these states that actively are providing Beads of Courage program. Like to share just again, if you were to donate beads or pendants, where do they go? So they might help a child in active treatment. So every bead guide has a category called Active Courage Glass Selection. That category exists on the bead guide very intentionally for things that we would not put in print on a Beads of Courage bead guide, but these are some of the more clinically challenging things that children we support might have to cope with. And that equips that frontline nurse with a one-of-a-kind art bead to give to that child on a tough treatment day, or maybe a treatment defining moment where they need an added boost of encouragement. We also use them in our complementary programs. So as I shared, we support families and we support clinicians. This work is very important to us because, as you can imagine, those are the sources of support for the child that's in active treatment. So we have a program for siblings. We love to give reflective beads to clinicians. Oftentimes clinicians will be invited to pick a smaller handmade bead that they can use as a metaphor for perhaps a patient that they care for very deeply, dearly, that maybe has died. And so the bead provides a memorial piece for them to hold on to, as well as bereavement. Pendants we specifically use in our programming with adolescents and young adults. So we're always actively requesting donations of pendants. It's our Power Pendant project, and it's a fast and growing program for us. Just like there aren't a lot of interventions to support children in active treatment, there are very few interventions to support the quality of life and coping of young adults. So here's things that we've accomplished together with our glass art community. We estimate that since 2003, over 1 million artist-made beads have been donated and distributed to children receiving Beads of Courage. We have a Dream Bead program. Again, these are all ways that you could get involved, as well as just a historical archive, if you will, of things that we've accomplished. Open studio events. If you go to our website, we are always seeking to establish new partnerships with other studios and communities. I really look at the studios as our brick and mortar for sharing our mission in their community. We have a Design a Bead and Bead of the Month programs. If you want to sign up for that, that's an amazing thing. We actually do consign artists to make our Bead of the Month. It's a fundraising program for us, as well as for our Carry Bead program. It is a fundraising and marketing program for our organization. So if you like production work, we're always looking for artists to make match sets for our Carry Bead program. I hope that you'll all put it on your travel list at some point to come visit us at our forever home in Tucson, Arizona. We just closed on that property back in November of 2024. And a great time to come is during the Gem and Mineral Show. We'd love to have you there. I believe we're all alchemists. We all have, our art really stirs the human spirit. So if you leave today, know that your work and the work that you're doing, you are an alchemist. You're stirring the souls out there with your art. And we at Beads of Courage, the beads that we give really, for me, are life saving in the moment that that child needs that bead. ways that you can support us that are easy, cost no money. Thank you again, Jim and Linda and Sarah and Catherine with the ISGB for this opportunity. We are a very small organization in terms of staff. We do not have a professional marketing budget. We need people to be ambassadors for our cause, share our mission. Hey, have you heard of Beads of Courage? What it is? If you're on social media, just sharing, letting people know who we are and what we do. We do have a bead shortage at Beads of Courage. Most of the beads that we use, that we give to kids, the core program beads, are manufactured exclusively for Beads of Courage. But where we need more beads are the glass beads, the glass art beads. So if you have a studio, if they haven't signed up to be an open studio partner of ours, please encourage them to do so. We do support open studio events with glass and things like that to share our mission, print material, and things like that. If it is a studio that's in a member hospital community, we always invite families, hey, go cheer on the bead artists that are making beads for Beads of Courage. Something that keeps me up at night is, wow, what if people stop making beads? What if there are no more bead makers? And so we've offered scholarships, we support with glass, and then what I'm excited about our new Forever Home is we're going to be establishing a bead making studio there in Tucson. Financial, of course, we are a nonprofit. All of the funds that we raise make it possible that children that receive Beads of Courage, it's free of charge for them to receive the program. We don't charge for the program. And so the manufactured beads, every $25 we raise helps provide 500 beads, which is the average number of child coping with cancer will receive in a year. So thank you again for elevating the vibration around our work. We really need your help to sustain our mission. I want to share this awesome. Now, we do provide string for the kids, but I wanted to share this amazing photo. Again, art in motion, right? This is a young man that I've known since he was 5 years old. And this is a mosaic that he's made with his Beads of Courage. This is pretty incredible display of his life journey. And these are my sons today. I love to share this. They're intimately involved with Beads of Courage, as is my daughter. When you look at what's emerging and the impact that we can have together as a family, community, and globally, making a difference in the lives of kids through Beads of Courage. So thank you again. I'm happy to answer any questions. Really appreciate this opportunity.
Jean, thank you very much. Very, very interesting. Maybe allow me to kick off a couple of questions. Where and how did you seize upon beads as the focal point of this effort? I'm curious.
Yeah, that really, as I shared, curiosity got the best of me. Working as a pediatric oncology camp nurse and the kids loving the beading activities, which led me to the Bead Museum. I was very inspired by learning that Boy Scouts were giving beads as symbols of honor and accomplishment based on a bead guide. So I collaborated with my friends in pediatric oncology and said, if we were to give beads to kids going through treatment for cancer, what would we give beads for? And we created that initial bead guide together. So the white bead for chemotherapy, yellow bead for overnight stay in the hospital, red bead for blood transfusion. And it wasn't until I knew we wanted a Purple Heart that I was introduced to the International Society of Glass Bead Makers. I could not find a nice Purple Heart for that completion of treatment bead. And someone said, well, let me introduce you to the Arizona Society of Glass Bead Makers. I'm like, what's that? I'm like, well, there are people that make glass beads. I'm like, these people exist? There are people who make glass beads? And so that's a fun part, again, as I shared, educating people that there are bead people everywhere, glass artists everywhere that are practicing this ancient art form of making things with glass. So that was really curiosity, got the best of me.
Oh, I love curiosity, no doubt about it. Liz, thank you. Jean, you've got an offer from Liz Brown to get involved. And Liz, I hope your health and well-being continues. There are two questions in the chat. One is, do glass beads have to be lamp worked or confusers create beads?
We primarily use lamp work. Kiln annealed is essential because, as you know, we're bringing these into a healthcare setting. So all bees must be donated to our Forever Home in Tucson because we do the quality control check on them before they're individually packaged to go out to the hospitals. Now, where fused beads and fused pieces could really benefit our organization is in the form of pendants. So we've been receiving a lot of fused pendants for our adolescent and young adult programming. And we're soon to hopefully launch our Touch for Strength programming for parents. So the fused pieces are those, I look at them as touch points. So that's where fused pieces would be most beneficial for us.
Where in Tucson is your new home?
So our new home, which is your home, so you all have a home in, when we closed on our property, I'm like, we're moving away from calling it our headquarters. It's not our international headquarters. It is the Bede family's forever home in Tucson, Arizona. It's located at 3301 North First, which is between Prince and Fort Lowell. If you're familiar with Tucson, we're on the First Avenue corridor. Our property is quite amazing in that it sits on almost a full acre in Tucson.
Wow.
The acquisition includes a 4,200 square foot building, which is our master bead pharmacy. Any hospital that implements Beads of Courage is distributed from our forever home. And then it came with an adjacent property, which we are hoping to develop. It's in that creative phase. A folk art school, I don't know, but we have a property too that we'll be developing.
So how do you engage or formally engage artists to become participants and contributors? That's another question that's come up through the chat.
So over the past 22 years, it's really just been grassroots effort, communicating, sharing. I've gone to the International Society of Glass Bead Makers gathering several years, partnering with glass studios, different chapters of the ISGB, and then obviously opportunities like this just to present, share our mission. If you go to our website, across the top toolbar, there is an artist drop down, and there it will say glass artist. It will bring you directly to the donation guidelines. Basically, any bead can come. I know the talent is amazing amongst the artist community, but honestly, just a small, simple round bead with some design to it. There are artists that donate sculptural beads. Often we save and reserve those for dream beads or events that we have with kids where they can pick out a one-of-a-kind special bead, but really smaller handmade glass beads. Fire kiln annealed is important for the durability. If you donate a little bit larger bead, maybe a tube-shaped bead, larger beads will be used for transplant. So kids that have to have a bone marrow transplant, heart transplant, whole organ transplant. If it's a bigger bead, we qualitatively separate it out and say that will be packaged as a transplant bead.
And can you talk a little bit about the kinds of conversations that you've had with the hospitals and the programs within the hospitals? I think that would be very informative.
Yeah, definitely. So to become a member hospital of Beads of Courage, we do have an agreement process in place, and really embedded in that agreement is the liability because we are bringing a potential choking hazard in the hospital. We're bringing an art-based intervention into the hospital. So we have an agreement with hospitals. So if you were to visit our website, we have a PDF of all the hospitals we're at. And as I shared, you'll see a little legend there. So many hospitals now, which is exciting for our organization, is they might have started supporting kids with oncology and they're like, hey, we want to support, we want a NICU program. We want a cardiac program. And so the legend will show you, if you were to look at that PDF, if you're looking to see if Beads of Courage is in your community, it's separated by state. And then the legend will say what programs they implement there. So we actually have a wait list for hospitals that want our program. It's a somewhat stressful place for us to be because we'd love to just and get them started with Beads of Courage. But part of it is funding. We need the funding. It costs $5,000 to start a program. And then on average, once it's started, that first big infusion of the startup of beads and program materials, print, everything they need to implement it as a bedside intervention, it on average costs maybe $1,500 to $3,000, depending on the patient population size to maintain that program. So I like to share it's the most cost-effective psychosocial intervention out there. It's not an expensive program, and it really improves the quality of life of kids receiving it. So if you know of a hospital in your community that might not have it, please get them in contact with us. My email, I help manage the outreach and startup of programs, and then obviously maintaining those programs.
Can you talk a little bit more and give some examples of how the beads are given, sort of the presentation? I
Yeah,
think that's the question, and how the
yeah.
children themselves are using them.
Yeah, no, thank you. I'd love
Please.
to. So, if you'll let me, I'm going to take off my background so that you can see hopefully the beads a little bit better. So when kids are enrolled in Beads of Courage, we first spell their name. So we equip every hospital with alphabet beads and then all the program beads. So um, we equip them with an alphabet bead box and then the different colored beads. So you can see on the sample strand. So the beads that we have manufactured for us are this unique shape, which was important to us at Beads of Courage. They're all glass beads. We didn't want to give our patients plastic pony beads that their healthy peers can get at the local Hobby Lobby or Michael's craft store. So these are manufactured for us. And then there's a bead guide that really drives the program that serves as the clinical intervention, if you will. Um, and that allows kids to just collect beads as they're going through the program. So there I go. I got my whole background off. I'm sitting in my kitchen. And so you can see here, so we give the hospital a print. So I'm holding the hematology oncology bead prescription, and then inside, so kids will literally document their medical journey in here, and they'll get beads, start collecting those beads from their healthcare providers. So I think the key thing is hospitals have to sign up to be a member hospital. And then our organization, to control really the quality and the program integrity, we provide all the program beads for them. Because we want a child in Anchorage, Alaska to be telling the same story of courage as a child in Florida or Japan or New Zealand. Every bead is the same that's used in our programming. I hope that was helpful.
Definitely, definitely. And Sarah Nelson has made some wonderful posts in the chat, giving your email, Jean, as well as some information, landing pages within the Beads of Courage website. I
Great,
think that are very helpful and very informative. Are
great.
there any other questions?
I have a question. Can you
Please.
hear me? I
We can
can't
hear
see
you.
anybody except for the two of you. Um, I'm just wondering, do you have like cards or something that we can spread the word? I know a lot. I was president of a Glass Guild around here that has like over 2,000 people, and they're having their annual meeting like this weekend, I think. I'd love to be able to like just hand cards out and say, hey, check this organization out.
Yeah, absolutely. I know I couldn't get them to you by this weekend, but we do have print support materials that we can send to you. If you email me, I get Jean, my email at beadsofcourage.org. I'm also the gatekeeper for info at Beads of Courage. So that's kind of our general catch-all, and then that helps me delegate to the right people. I think it's also important to mention that, of course, if you personally know of a child or a family could benefit from our work, we have no eligibility criteria, if you will. If it's someone that's coping with cancer or another serious illness, if you refer them to us, we actually mail beads to over 2,000 kids from our forever home. And these are kids that maybe they have a rare condition that the hospital didn't adopt Beads of Courage to support. Or maybe it's someone that is receiving treatment at a hospital that they don't have Beads of Courage. We never turn anyone away. If they email us, we have volunteers Monday through Friday that pack beads for them and mail them. And we have a back-end online portal, if you will, where parents and families can request the beads that they feel their child should be receiving to document their courageous journey.
Wow, that's great. Thank you so much. I'll
Yeah.
definitely email you.
We also have a holiday. We have 3 online auctions a year. We just today, in fact, are closing out our World Beads of Courage Day auction as a fundraiser. We will be asking for donations of finished pieces for our holiday auction. So if perhaps you have a piece that's been sitting there that hasn't found a home, we always appreciate donations of items that we can put in our auction. A lot of our families, that's how they like to support our mission, is participate in our auctions. And as I shared with you again, every $25 we raise helps us provide 500 beads, which is the average number a child receives in a year in our oncology program. Now, a NICU, a premature baby, in our NICU programming, that baby might accumulate 500 beads in just 3 months.
Wow. If should fused pendants have a certain fastener, or do you put that on yourself through your quality control?
Actually, if they come with already a pendant, the fastener or that, like some of the borosilicate artists, for example, they'll already fuse their own onto the pendant with glass, but we have received pendants with a manufactured, glued on, if you will. Jim, help me, I'm blanking on the name of it, to hang it from, the thingy. And we accept those because when we're
That's
at event, yeah.
that's a scientific term. I think that we're very
Yeah, bail. There we go. Thanks, Sarah. It's a bail.
yes, there we go.
Yes, and just so you know, when we get these donations, you can't access it, but we have a back end online power pendant shop, if you will. So if an AY young adult contacts us, we give them that private link. They pick their power pendant out, and then we send it to them from Beads of Courage. Same is true for the wooden bowls that the wood turners donate. We send them the link. They can order the bowl they want that we have in our collection, and we mail that to them.
Linda, this may be a good opportunity to at least stop the recording, but we're going to stay online for a few extra minutes if people want to continue the conversation or talk amongst themselves.